Patients with ST segment elevation myocardial infarction, or STEMI, often have multivessel coronary artery disease, with a culprit lesion causing the acute event, as well as non-culprit angiographically significant lesions. Whether to manage non-culprit lesions conservatively with guideline-based medical therapy, or through routine revascularization by percutaneous coronary intervention, or PCI, is a common dilemma. COMPLETE was a multinational randomized trial comparing complete revascularization with culprit lesion-only revascularization in patients with multivessel coronary artery disease presenting to the hospital with STEMI. 4,041 patients were randomized to receive either routine staged PCI of all suitable non-culprit lesions within 45 days after randomization, or guideline-based medical therapy with no further revascularization. The co-primary outcomes were a composite of cardiovascular death or new myocardial infarction and a composite of cardiovascular death, new myocardial infarction, or ischemia-driven revascularization. At a median follow-up of 3 years, the composite of cardiovascular death or new myocardial infarction had occurred in 158 patients in the complete revascularization group, as compared with 213 patients in the culprit lesion-only group. The composite of cardiovascular death, myocardial infarction, or ischemia-driven revascularization occurred in 179 patients in the complete revascularization group, as compared with 339 patients in the culprit lesion-only group. There were no significant differences in bleeding, stroke, or stent thrombosis between the two groups. The authors conclude that in patients with STEMI and multivessel coronary artery disease, staged non-culprit lesion PCI with the goal of complete revascularization reduced the composite of cardiovascular death or new myocardial infarction as compared with culprit lesion-only PCI. Full trial results are available at nejm.org.